Hello everybody, welcome to my YouTube channel. Welcome to Healthy Lifestyle Matters. Indeed, healthy lifestyle does matters. Welcome to another episode of Health Talk. So for those who don't know me, my name is Stephanie Agbonkwai, but I'm popularly known as Daughter of Zion. Thank you for tuning in. Thank you for watching the video. Without wasting much time, I'm going to dive into what brought us here today. Okay, guys. So today we're going to be talking about a very, very important topic that is threatening our society today. So what are we going to talk about? Today we're going to talk about miscarriages, otherwise known as spontaneous abortion. So we're going to start by defining what miscarriages is. We're going to talk about the causes of miscarriage, and then of course we're going to go further to talk about the signs and symptoms of miscarriages, also known as spontaneous abortion. Then we're going to talk about the diagnostics, and of course we're going to talk about the remedy. Yeah, so just to give you a clue, that's what we're going to talk about today. So without wasting much time, let's dive into what Brother said today. So what is miscarriages, or what is miscarriage, or also known as spontaneous abortion? What is spontaneous abortion? The common definition of miscarriage is pregnancy loss. Pregnancy loss, within the period of 5 months before gestation. Gestation is a period between conception and childbirth. So, like I said, miscarriages is a pregnancy loss in less than 20 weeks. That is 5 months before gestation. Gestation is a period between conception and childbirth. So that's the definition of miscarriage or spontaneous abortion. Now let's talk about, there are different, before I go to the causes, let's talk about different types of abortions. We all know there are five different types of abortion. We have threatened abortion, we have missed abortion, we have complete abortion, we have incomplete abortion, and we have inevitable abortion. So those are the five common types of abortion that we experience with patients or pregnant women when they come to the hospital for checkup. Yeah, let's start by defining one at a time. So let's talk about a threatened miscarriage or abortion. When I talk about abortion, we all know another name for miscarriages is spontaneous abortion. So the first one we're going to talk about is threatened miscarriage or threatened abortions. Whenever I talk about abortion, I'm talking about miscarriage. So let's talk about the first one, that is threatened miscarriage. Threatened miscarriage is it's a condition that indicates the potential loss of a pregnancy. When threatened abortion or threatened miscarriage occur, is indicating that the baby might lose the pregnancy, or the baby wants to come out unexpectedly. So threatened abortion is a condition where it indicates to you that there's a possibility, or there's a high risk of you losing the pregnancy. So that is what threatened miscarriage is. Now let's talk about the second types of abortion. We talk about threatening abortion. That is abortion that these are signs or potential risks of you losing the pregnancy. Now let's talk about inevitable miscarriage. Inevitable miscarriage is the presence of the presence of an open internal OS where you have bleeding. And when you have this bleeding down there, there's a potential risk of you losing that baby completely. So that is what inevitable abortion is. It's a condition where you have opening in your internal OCs. And when you have bleeding in your internal OCs, there's a high risk, or this is showing you signs that of course you're going to lose the pregnancy at the very early stage. So that is what inevitable abortion is, or inevitable miscarriage. When you start witnessing bleeding underneath there, those are all signs to tell you that you're going to lose that pregnancy in the very early stage. Don't know why my camera is shaking, but it's fine now. So third point, let's go to miscarriage. This is the most painful one. I really don't want to talk about this, but of course I got to talk about it. So miscarriage. Miscarriage is a condition where the baby has already died in the womb. So painful. Miscarriage is when the baby has already died in the womb. And the funny part about this thing is that the mother does not experience any signs or symptoms of miscarriage when the baby when this condition occur where we have miscarriage is when the baby have already died in the womb and the mother is experiencing no pain, no sign or symptoms. This is really, I really don't want to talk about it, but I gotta talk about it. So miscarriage is when the baby has already died in the mother's womb and the mother does not experience any signs or symptoms or any pain. You can imagine you carrying a baby for 9 months and God forbid the baby died in your womb and you thinking that you're carrying a living child, whereas the child is dead. You only want to go find out from the hospital. Okay, with that being said, let me point out something. When, as a pregnant woman, I always tell pregnant women that whenever a day or two passes without you feeling, especially when it's getting to about 6 to 7 months, when you are not feeling any signs of the baby, you know, moving in your stomach, you got to go do a checkup, guys. That is the only way to talk about miscarriage. Whenever you feel like, oh, the baby have not kicked, the baby is not moving, there is no movement in your stomach, because the baby has to be moving, especially between 4 to 5 months. Yeah, the baby has to be moving or showing signs of movement in your stomach. So if you don't experience any movement, it's important that you go check out with your doctor or you go for ultrasound or anything. Just go do your regular antenatal care, because you might never know. You don't want to be carrying a dead baby in your stomach. Nobody wants to do that. It's so painful. I really feel bad talking about it, but of course I have to talk about it. So that is what miscarriage is, when the baby has already died in your womb and you don't experience any signs or symptoms. There is no pain. You are just your normal self. Please, it's important you go check up when your baby is not kicking or when there is no movement in your stomach. That will help you. Yeah, so the fourth point, we talk about incomplete miscarriage. What is incomplete miscarriage? Incomplete miscarriage is a condition where you know, you start experiencing a blockade, like, you know, something is coming out of your stomach, but it's not complete. Not all the tissue is completely out, you know, it's just partially out, not completely out. When you start experiencing, you know, bleeding, not really bleeding, but tissue, body tissue or fetus tissue coming out of your organ and then coming out of your private part, and then you cannot, it's not really complete. That's why it's named incomplete miscarriage, because you see a potential of something coming out, but not all the tissue is coming out. And that's take us back to complete miscarriage. Complete miscarriage is when you experience, it is a complete, when all the tissue completely comes out of the uterus. When the tissue completely comes out of the uterus, that is when you know that you have a complete miscarriage. And sometimes this comes on its own. There's no medical thing that happened. It just comes out on its own. You didn't have to do any major procedure. You don't have to do any medical assistance. It just comes out of its own. That's what we call it complete miscarriage or complete abortion. And then incomplete is when just part of it comes out, not all the tissue comes out, just part of it. So those are the five types of miscarriage that occur. And you know, it varies to some people, and you might want to check, because sometimes you might have a complete miscarriage and you're thinking it's incomplete. So you want to check out too that with your doctor. Now let's talk about the signs and symptoms of miscarriages. Yeah, a lot of people experience miscarriage, they don't know. But let me tell you something. When it comes to signs and symptoms, it's not applicable to everybody. Not everybody that experience miscarriages go through maybe all or some of these signs and symptoms. Human beings do vary, so of course individuals vary. So let's talk about the most common signs and symptoms of miscarriage. One, we have abdominal pain, especially around your pelvis. We have some people vomiting, nausea, and some people intense bleeding, like chronic bleeding. They bleed till. Yes, some people experience a chronic bleeding, and some people experience you know, back pain around the spinal cord, around lower pelvis. So some people experience pain, and also some people experience, like I said, massive bleeding, like bleeding within non-stop, like it just keeps coming out. Those are the most common signs and symptoms of miscarriage. And of course, you know, body changes, body weakness, especially when it's already out. In the case of incomplete, when some is out and some is not out, you start experiencing fatigue, body weakness. You start experiencing, you might experience fever or high body temperature, because I mean your body is trying to, you know, absorb the pain, or maybe, you know, trying to figure out what's going on. It might leave you with the temperature. And also we have fluids. We have vagina fluid, not really, it comes with blood and sometimes with discharge, so you want to check out for that. Also we have back pain, like I did mention. There are a lot of, you know, signs and symptoms that come with miscarriage. You just have to figure out which one works best for you, because some people, they do experience signs and symptoms, some people they don't. Yes, especially when it comes to miscarriage, where the baby already died in your womb and there is legally no signs and symptoms that you experience that tells you that something is wrong with the fetus. You just see it, and you know, you see blood coming out. So please watch out for that too. Also, on some of the causes, we have uterine contraction, we have uterine bleeding, we have cramping, especially uterine cramping. We have irregular blood tissue passing out of your vagina. We also have pelvis cramping. Sometimes people who have miscarriage have pelvic cramping around their pelvis, and also abdominal cramping. You know, they have contraction, they have uterine contraction, and also some of them experience fatigue, a gross one, because this is very, very chronic, so they experience a lot of fatigue. So with that being said, let's talk about the causes. What is going to cause you to have miscarriage? This is the most okay. People want to know what's going to cause you to have miscarriage, huh? Okay, we're going to talk about it today. So talking about causes of miscarriage, first we have infections. Okay, we have infection. We have maternal age. We all know that there's a certain age, you know, we talk about menopause, 45, some people 50, you know, depending on you know, family history. So talking about causes of miscarriage, we have maternal age. There's a certain age for a woman, especially above 45, you know, there's a high risk of you having a miscarriage. Causes of miscarriage, we have infection, we have maternal age, we have also you know, work environmental condition, you know, workplace condition, working in a workplace where there is toxic agents. We have hazard you know, chemicals that can cause you to have miscarriage. We're talking about smoking. Okay, if you're pregnant, you want to stay away from smoking, because smoking is going to cause you to have miscarriage. Chronic smoking is going to cause you to have a miscarriage to some people. We talk about family history of miscarriage. If you know you're coming from a family where there's an iota of, there's a lot of miscarriages, there's a possibility that you might have it, because sometimes it is genetic. And also, talking about miscarriage, we have other signs and symptoms, such as illegal consumption of, you know, illegal drugs. You know, you pregnant, there are some certain drugs that you cannot take. Marijuana, cocaine, you name the rest. There are some certain drugs you cannot take. Also, we talk about chromosomal abnormalities, that is defect from development. We talk about the quality of sperms. You know, your miscarriages that also only come from the women's part, it comes from the men part as well. Talking about you know, quality of the sperms, you want to make sure your sperms are high quality. Eat food that gives your sperms good quality, like bananas, you name the way. So also we have excessive weight as causes of miscarriage. We have excessive weight, we have excessive consumption of caffeine, excessive consumption of alcohol, you know, hormonal abnormalities. And then we also have implantation, you know, when the egg is not rightly implanted into the ovaries, that can lead you to miscarriage. We have you know, hormonal abnormalities. We also have stress. We also have trauma. We also have family background, family history of miscarriage. We also have things like excessive consumption of caffeine. We also have food poisoning, and we also have implantation, that is, you know, when the egg is being fertilized and, you know, the fertilization or the implantation does not occur, especially in the uterus, that can cause you to have a miscarriage. And also we also have incompetent cervix, excessive weight. We also have uncontrolled diabetes, and also we also have uncontrolled high blood pressure. We also have fibroid. So those are some of the causes of miscarriage. You want to stay away from smoking, stay away from excessive consumption. If you are, please, heavy weighted, please, you want to make sure to reduce weight, because excessive weight It's going to cause you to have a miscarriage. Yes, you heard me. Excessive weight. You want to watch out for that weight. Watch out for your alcohol consumption, caffeine, food poisoning, illegal drugs. Certain medications too can cause you to have an abortion. That is why a pregnant woman is not allowed to take any kind of medication. It has to be like doctor prescribed. Don't go about taking any kind of over-the-counter medication and you think everything is okay. It is not okay. So you want to make sure that you're taking medication that have been prescribed by your doctor. So illegal drugs, like I did mention, is a no-no. We're going to talk about incompetent cervix. Also, we're going to talk about family history and some of the causes of miscarriage. So those are some of the few causes. There are a lot of causes I may not mention all because I don't want the video to be too lengthy. But those are most causes of miscarriages in women. So let's talk about treatment now. We talked about definition of miscarriage. We talked about the types of miscarriage. We talked about signs and symptoms of miscarriage. We talk about causes of miscarriage, and of course now everybody's now listening, huh? What next, huh? So we're gonna talk about the treatment or remedy of miscarriage. So unfortunately, let's talk about the treatment. Unfortunately, miscarriage cannot be reversed once it has started. That's a bad news. Yeah. Unfortunately, miscarriage cannot be reversed once it has started, which means if you're experiencing miscarriage, there's nothing anyone can do about it because it's already coming out. Especially the complete miscarriage, those are, some of them are, it's irreversible. You cannot reverse it. You cannot turn back the hands of time so that it doesn't come out. Unfortunately, once a miscarriage has started coming out, you cannot stop it. It's irreversible. But however, there are some medical procedures such as dilation and curettage that can be done, to help out the condition. But like I said, once miscarriages have started occurring, there's nothing we or anybody can do about it, unfortunately. I'm so sorry, but that's the simple truth. Especially for complete miscarriages, once it has started coming out, there's nothing you can do about it, or either anybody can do about it. But however, there are some medical procedures and medications that can help, medical procedures such as dilation and curettage. We can put on some medical procedures to see, however, how we can help, especially for incomplete miscarriages, missed miscarriages. No, not missed miscarriages, because missed miscarriages, the baby's already dead. So in some cases, they can do dilation or they can do curettage, but miscarriages is irreversible. Well, with that being said, at this point, support is widely needed, especially for the mother, because the mother just lost a fetus, a baby, of course. So counseling and support is highly needed as the mother is grieving or mourning the fetus that has passed on. But nevertheless, you still got to support them, be for them, especially if you are the husband, if you are the sister, if you are the family member. Miscarriages is irreversible, but there are some medical procedures, like I said, that can be put in place and to help out some of the complications. We have dilation and we also have curettage. So I'm just gonna list out some of the few, I think there are about 3 points that when I talk about medical procedures that can be done in the case of miscarriages. But like I said, it's irreversible once it has started, especially for miscarriages and complete abortion. That one is irreversible. But however, we're trying to put things together to make sure that the complications does not get worsened. All right, on the treatment, we have expectant management. Expectant management is just basically monitoring while waiting. You monitor the condition, and then you see while you're waiting if it's gonna be which of the abortions, either it's gonna be complete abortion, incomplete abortion, whether it's gonna be missed abortion. You just monitor and you see, because most of the times these cases, like I said, is irreversible once it has started. Okay. Also, we also have after expectant management, we also move to surgical evacuation. Surgical evacuation is D plus C, that is dilation and curettage, and we also have manual vacuum aspiration. So these are some of the medical procedures that can be done, but still it's not guaranteed that your miscarriage is going to be reversible. You know, it's vice versa. It's a 50-50 something. You know, they're just trying to make sure that, you know, the complications after their miscarriage does not get worsened, and make sure you are okay and fit, you know, to try again for the next move. So we have these are some of the things that can be put to place. They can do you dilation, and they can do you curettage, and also they can do manual vacuum aspiration, you know, if that might help. But like I said, in most cases it is irreversible to do it. Lastly, under treatment, we have medical management. You know, medical management such as misoprostol can be offered. But like I said, abortion in most cases, or miscarriage in most cases, is irreversible. Well, this is a very pathetic story to tell, or this is a very, you know, sympathetic, you know, health talks to talk about, because it is not really a good thing that you carry a baby and the baby pass on in your womb, or the baby, you have a miscarriage. The aim of every pregnancy, most pregnancy, is to have a child, and if you are not able to have a child due to miscarriage, it's a very rough story that nobody wants to talk about it, because it's very, very pathetic, because nobody wants to go through all of that. You know, pregnancy on its own is a whole lot of stress. You know, some people get sick all throughout the pregnancy, and then just for you to realize you have a miscarriage, it's a very bad thing. I mean, it's not a good thing to, you know, talk about it, but of course we're talking about it to help you. Like I said, if you feel like you have any of these signs and symptoms that I've did mention, you don't want to take chances. You want to go see your doctor, because you might never know which type of miscarriage you have. You don't know if it's threatened abortion or miscarriage. You don't know if it's inevitable miscarriage. You don't know if it's complete miscarriage or incomplete. You don't know if it's miscarriage when the baby is already dead in your womb. It is important, like I will always say, if you are pregnant and, you know, a day or two goes by without you hearing the baby movement, it's important that you check with your doctor, because you might never know what's going on. You know, that might be that you have a miscarriage where the baby is dead in your womb, because normally a baby will start kicking, I think, within 5 months, 4 to 5 months, 6 months. Yeah, the baby will start kicking. At least there will be some sort of movement in your stomach. But if that is not happening, or if that's not the case, then you might want to go check out that with your doctor, because you don't want to take chances, because it might be too late. Because I mean, the earlier they find out what's going on, the better they can help you with these medical procedures that I did mention about medical surgical evacuation. We have medical management, and much more. We have dilation, we have curettage. They can help you with all that. This hadn't been, maybe they realize it early, so you want to check out for that. And also, please, if you're having any of these signs and symptoms, talk to your doctor. Don't be shy. I don't know if it's threatening, if it's something that you might think is minor. Don't take anything for minor till you find out from your doctor. Pretty much, I think that's really all what I have to tell you guys for today. If you have any questions or any comments, please leave it in the comment section below, and I'll attend to it as soon as possible. Thank you all for watching. Thank you for subscribing. Please, if you haven't subscribed, please subscribe and share this video to as many people as possible, because it might be of help to somebody. Somebody might be going through this, and you might just help somebody to get a valid information. Thank you for watching. I'll see you guys next week.